We are at an all-time high for women in the workplace. We are seeing more and more female entrepreneurs, and millions of women are choosing to work full or part-time while raising their children. And we have more women in perimenopause and postmenopause in the workplace than ever before in history. Actually, 45.5% of US women at work are in perimenopause or menopause, and it is reported that a whopping 88% of those women are experiencing symptoms of this hormonal change, like hot flashes, weight gain, anxiety, and more. Here to talk about this very important matter is Dr. Mache Seibel. Dr. Mache is a leading menopause expert who helps women get the information they need to feel better and have more control over their life, their work, and their relationships. He is a 25-year member of the Harvard Medical Faculty, author of the best-selling books, The Estrogen Window and The Estrogen Fix, and editor of the #1 digital magazine for midlife women called Hot Years Mag. His latest book, written with his wife, Dr. Sharon Seibel, is Working Through Menopause: The Impact on Women, Businesses, and the Bottom Line. Before transitioning to focus on menopause, Dr. Mache was a leading expert in infertility who performed some of the first in vitro fertilization successes in the United States. Dr. Mache has published over 200 scientific articles and 17 books for both professionals and consumers, and has received multiple national awards for patient education, research, and writing. He is also an award-winning musician. He is a board-certified gynecology and reproductive medicine and a NAMS certified menopause practitioner. He has years of experience providing coaching to women from around the world, helping them become a partner with their healthcare provider, available at menopausecoaching.com. I interviewed Dr. Seibel a few years ago about his book, The Estrogen Window, and I will link to that episode in the show notes. But welcome, Dr. Mache. It's so nice to have you back.
It's a delight to see you and to join you.
Yeah, so I was just saying before we started recording, this is new to me as well. And it's so, I feel like ashamed that I haven't even considered this, which is, it's a huge problem, way more than I ever would have thought.
Yeah.
That women are experiencing this. So what caused you and your wife to decide to write this? Like, what were you seeing in your practice? What made you think we need to educate people about this?
Well, as you may recall, my reasons for transitioning from the fertility world into the area of menopause really had to do with my wife, who had surgery that threw her into early menopause only months after the Women's Health Initiative, that study that incorrectly stated that taking hormones could increase your risk of breast cancer and heart disease and other things. Well, that was proven wrong, but the damage was done. And so she was having the need for hormones at a time when it was very hard to get them. And I frankly needed to transition to see whether she could get some information and some help so that she wouldn't have to tough it out. I needed to figure it out. And in this domain, the area of working through menopause, it has been something that I've been aware of for some time. There's so many women going through menopause, early menopause, perimenopause, excuse me, that are struggling at work because they have the symptoms of menopause that don't stay at home when they go to work. They're struggling with hot flashes or brain fog or anxiety. They have to go to the bathroom more often. The temperature is wrong in the room that they're in, and it's challenging. And this is a big problem, and one that in the United States, less than 1% of the workforce, or less than 1% of businesses are supporting the workforce in this demographic. They're just not doing it.
Mm-hmm. Yeah. And you've got a great story actually in the book about Michelle Obama. So tell me about that.
Well, people probably know that Michelle Obama has been going through the symptoms of menopause. And actually, what finally got me to write this book and really get started on it was the fact that I got a call from the Washington Post to do an interview about the podcast that Michelle Obama had just recently done, saying that she was getting off of Marine One to go give a talk, and she felt like her body was on fire and drenched her clothes and she was sweating. And she's supposed to go in this room full of people and be talking. And it just wasn't happening in a very good way. And she was saying that, if this is something that half of the people are going through and we're pretending it's not happening, I mean, we have to just address it, and we have to talk about it and then do something about it. So my approach to doing something about it was to make some noise in the form of getting a book out that people could, learn about the issue. And it's a big problem for the workforce, because you have women at the peak of their capacity in terms of, they have their wisdom, they have their experience. They're at a time in life when they should be trying to go up through the corporate ladder or advancing their own businesses, if that's what they're doing. And what's happening instead is, because of the Women's Health Initiative, the legacy of that study, only 10% of women today in the United States, and I think it's pretty true worldwide, are being treated for their menopause symptoms. Yeah. So 90% of women are untreated. As a result of that, they're dealing with their symptoms by enduring them, by suffering through them, and they're at work and they don't have anyone that has awareness about it. There are no policies for it. And last week, I was participating in a conference that was actually in Canada, and it was a disabilities conference. And the disability that I was speaking on was menopause. Because in the United Kingdom and in Canada, menopause is considered a disability. In the United States, we have more prim and proper thinking about it. So menopause is a natural event unless a woman has her ovaries removed when she's still menstruating, so that it's early menopause or surgical menopause. And that is considered a disability because something has been done to her to cause it to happen. But I don't think it's so much a disability as much as it is an inability to get support and information and treatment and people care. I mean, if one of my daughters had a baby not that long ago, and when that happened, she had maternity leave. If she had any issues or questions surrounding breastfeeding, she had a lactation coach. There's all the support for young women as they go through their childbearing years. But once that ends, support ends. Yeah. And it's like, and we have to remember that the millennials, who are a large group of people, are now turning 40. Mm. And we have to also remember that menopause isn't about age, it's about transition. By that I mean, while the mean age of menopause may be 51, about 5 to 10% of women enter menopause before age 45 and 1% before age 40. And if you think about it, the symptoms start up to 10 years before that. Yeah. So women that are 40 could well be experiencing the symptoms of perimenopause, that window of years that lead up to menopause, and not even realize it's menopause. In fact, many of the women that I see early on have gone to a cardiologist because they're having palpitations. They may have gone to a urologist because they're having bladder sensitivity. They may have gone to a sex therapist because they're feeling less libido. They may have gone to someone, a psychiatrist or a neurologist, because they're having brain fog and they're worried they're getting dementia. They're just going through perimenopause and no one's aware, and the workplace is certainly unaware and unsupportive. I'm hoping through ignorance, and that more will be done now.
Yeah, it is mind-blowing, truly, the lack of education and help for women during this time. Most women don't know that they're going into perimenopause, often in the late 30s, early 40s. Like you just said, they don't know why they're getting all these symptoms. because nobody's telling them, and they all have it in their head that that doesn't happen until we're in our 50s. And
Right.
we get so, like, I went into menopause before 45. And that's the thing. I'm healthy. I eat well. I exercise. I was doing everything right. And a lot of women think that because they do that, oh, well, I'll be untouched by this time because I'm so healthy. And it just doesn't work like that. And suddenly you're suffering and you're going, where can I go for help? And you go to your doctor. So, what are doctors being trained as far as like menopause goes? How much education do you get as a MD in medical school about this?
Well, it's interesting. When the Women's Health Initiative came out in 2002, it was right at that time that the gynecology residency programs and other programs were trying to cut back the number of hours that doctors were being in training because they thought they were too tired to take care of people. Well, there's some basis of truth in that. Excuse me. But what ended up happening was that the areas that they ended up cutting out included menopause. So that they felt that menopause was something, well, it's not that big of a thing. We have cancer we have to deal with. We have bladder issues we have to deal with. We have deliveries we have to deal with. There's those things that we have to. But not every woman will have cancer. Not every woman will have a baby. Not every woman will have infertility. But every woman who lives long enough will go through menopause. And it turns out that only about 1 in 5 residency programs, the training programs for obstetricians and gynecologists, offers menopause training as part of their program, or any more than a couple of lectures. And it turns out that in the general practitioner area, probably less than 10% now are offering training specifically in menopause, whereas that's going to be all of their patients that are female, half of their patient population. And women are more likely to go to the doctor than men. So an overrepresentation of their patients will be experiencing this, and they're unprepared. And that's a sad thing. And then those symptoms, as I was mentioning, end up in the workplace. At least 2 out of 3 women in the workplace are saying they have 3 or more symptoms. And that same number are saying that it's interfering with their ability to perform at their peak. But they're going to go to some younger person, perhaps, who's in human resources, who may not be familiar with it. There's no policy in place for it. They don't really know what to do. And there's the issue that menopause is a taboo topic in the
I was just
workplace.
going to say that. Like, how many women are so embarrassed to go and say, I'm having a hot flash during a meeting? You're maybe having to give a talk for your work, whatever position you're in, and suddenly you're dripping in sweat and red in the face. It's embarrassing. And you don't want to say, I'm going through menopause, because then you're admitting to aging, which is, stereotyped as being this terrible thing for women to do. We're not supposed to age.
Well, one of the things that I talk about in the book, in the Working Through Menopause book, is the fact that this is impacting enormously on companies. Right now, in the United Kingdom, which is ahead of us, in England, they're about 10 years ahead of us in terms of supporting menopause in the workplace. Just though, in the last few years, there was a report that came out recently that said that as a result of menopause, women doctors and nurses had left the workforce because of menopause symptoms. That were about 41% of women in that situation were leaving. So
Wow.
right away, you have, you want to have a case and you need an anesthesiologist, but the anesthesiologist isn't going to be there because they're out. They've decided not to continue doing this because the strain of the work and so forth, and they don't have support. And so they stop, or, many other situations. So what's happening is that it's creating an impact on the workforce for healthcare, but also in businesses. And as I said, you have all these women at the peak of their careers able to do so many things, and yet they are opting to take less strenuous positions because they don't have any support. And that's a real shame, because it's costing people replacement to have to replace the individuals. I mean, it'd be much less expensive to just support them and offer them information and awareness, and also make the business menopause friendly, so that they could have a situation in which there is enough ventilation. A woman could control the ventilation for herself. For instance, they have rooms when you have a baby and you want to nurse. They have nursing rooms and things like that. But if you have a hot flash and you need to go pull yourself together for a few minutes, there's nowhere to go for that. And also, one of the things that has happened as a result of the pandemic and so forth is that there's a little bit more work at home, which gives people a little more flexibility. But often at work, there's not so much flexibility when you're in the box office setting. And that makes it hard if you didn't sleep well that night and you really need just a little time. You're happy to do the work, perfectly able to do the work, but give me a minute to get myself together. I didn't sleep last night. So this kind of accommodations, more bathrooms so that women have an opportunity to go if they have a sensitive bladder, and can get to the bathroom. There's a lot that businesses can do, but they aren't doing them.
Mm-hmm. In your book, you mention how the UK is like way ahead of us on this matter. And they've started to educate high school students about menopause, which I thought was so brilliant, because teach us young what's going to happen so that we're not surprised, or we know how to deal with it when the time comes. But they're also way beyond just in the workforce. So what are they doing that we're not?
I want to follow up on one moment just on that, and that is that almost every young girl gets the talk about her first period.
Yeah.
Every young girl knows at some point that, it's going to happen. I have to be ready, and, they know what to do. No one has a talk about their last period. And so moms don't talk about it to their daughters. It's often not talked about amongst peers. And so it leaves women just trying to figure things out on their own, which is a very difficult thing to do. In terms of the workforce in the UK and things that can be done, there are beginning to have policies in place that allow a company to, first of all, let's talk about menopause. Just acknowledge it. I mean, if you can say it out loud, it's not such a boogeyman.
Yeah.
And if you can just talk about it and normalize it, then a person doesn't have to feel uncomfortable saying, I'm up here in the front. I'm sorry, I can't remember your name, but I'm having one of those moments. I'll be with you in a second. Or I had a hot flash. Excuse me for a minute. I'm going to pull myself together. Okay, let's continue.
Yeah.
You can't say that, but at some point it will be possible. And one of the things that's going to make it possible, I think, is legal issues that are happening. Because what has happened is that at least in the UK, for instance, they have something called tribunals, which is a small group of people that get together and discuss cases that are brought before them to do with what's going on in the workplace. And that can be binding and cost the employer money if something is done in what's considered a discriminating way. And there's been a number of cases now in which issues related to menopause have been compensated for someone not acknowledging and accepting that the woman was having a physical condition for which she was performing a certain way, or something happened. And so there's starting to be financial impact to companies in the UK. In the United States, there's just the beginning of that, But the stage is set. There's a couple of things that have been very interesting, some legal cases, one in which a a group of women who were croupiers at a very large casino, the ones that kind of sit there and the ones that kind of sit around and watch everybody and see what's going on down on on the gambling floor. They noticed that when they started getting over 40, they were getting fired and they were replacing them with younger women. And so they started talking amongst themselves and they brought a class action suit that won at a very high court. And so this got into age discrimination. Mm-hmm. And then there was another case that came forward, and this was seemingly very unconnected, but was, and that is a person who went to work at a funeral home. And during the course of their employment, realized they were transgender and had sex changing surgery. And so they came in as a male and ended up as a female. And transgenders can also have menopausal symptoms. But in any event, the person got fired because of this sex change. Now, this seems to have nothing to do with menopause, but what it did is created precedent in that it was a gender issue.
Yeah.
So we had the gender issue, and then with the croupiers, we had the age discrimination issue. And those two things together melded to form the basis for the possibility for menopause to be considered something that has legal support if a person is treated poorly or unfairly because of menopause. So in the United States, this is all recent court cases. And so there is court precedent for it. Even though these things sound very disparate from menopause, it's the precedent that has to be in these two areas that come together to make that supported.
Yeah, and it's the start of the change, I think, right, that we're going to start to see now. So what is it that we can do as listeners to you? What can we do to start changing this?
I think the main thing is to be aware that menopause is happening. Mm-hmm. And it's happening at work as well as at home. And that it's important to find advocates in the workplace to support you and to be supportive of these changes, and to try and look for ways that companies can get support policies. I've been talking to some companies and offering to come and support and to offer how to make their place menopause friendly so that it can be a more impactful business for all of their employees and not just some of their employees. Mm-hmm. And also, hope to get policies, get acknowledgements, celebrate Menopause Awareness Day or International Menopause Day, or things that are related so that people can say the word and realize nothing bad is going to happen. And by talking about it out loud, there needs to be educational abilities in the companies to not only for the women, which is important, but also for managers and for HR and for people there. If you have someone who has no awareness of this, they just can't relate to it. And they can't even have an empathy for it because it doesn't make sense to them. What are we talking about? Mm-hmm. And the understanding that it's a physiologic change that's happening, and it may be natural and may be normal, but it can still be impactful. And we need to address it so that our workers are supported and they can be their best on the job and feel better personally. And as this happens, I remember when the first in vitro fertilizations were being done in the United States, I was very involved in that. And I remember that I was very involved in advocating for coverage for that, for insurance purposes, and getting policies in place for infertility. And as this began to get more mainstream, because today fertility is just one of those things that people do, it's not anything unusual, but women would choose to go to businesses that supported them in that area. if they had insurance for it, if they had policies for it, if it made work and life easier. And I think the same is going to happen for women in this demographic. I think that companies that are more supportive are going to find women gravitating to them. And I also think that it's going to help them because they'll have better retention. They'll be able to retain their people there longer and have them more effective. I mean, we know that if a woman is having menopause symptoms and they're really bothering her, she may lose an hour plus a day in productivity. And if it's treated, that's not going to be the case. We also know that just one symptom, like say hot flashes, which is very common in the United States, that is a 14 billion with a B, $14 billion cost to businesses.
Wow.
In direct and indirect costs, just hot flashes. If you look globally at the world, because about a fourth of the world's total workforce are either in perimenopause or menopause. So we're talking about an $810 billion issue for the workforce. Wow. That's completely overlooked. I mean, this is worth thinking about.
Yeah. And I think we just need to talk about it more so we take the charge and that negative association with it out. We have to, and that's up to us, the women, to start speaking about it, to start educating our coworkers about it. And like you said, just being like, I'm having a hot flash right now, excuse me, and this is what happens. And I'm going through menopause, and be proud to say that you are going through menopause rather than ashamed and hiding in the bathroom or quitting your job. Like, look at how many women are quitting their jobs because they're ashamed to get the help that they need and to admit to their coworkers that they're going through menopause. That's really sad.
Yeah, it's sad, but it is true.
It's true.
And it needs to change. And it'll be to the betterment of the women. It'll be to the betterment of the company. It'll be the betterment of society. I mean, we can't overlook or ignore something that's happening to all of the women, whether they're working or they're not. And more women are working, and more women are working longer.
Yes.
So the workforce, is a female component of it, is getting bigger and staying longer. And so women need to meet their potential by optimizing their biology and getting the information they need, the support they need. And when that happens, lots can come along with it. And I think also, as we get more and more women and the higher levels of businesses and organizations and things like that, they may be more supportive. That's not always true, but it often is true. And I think that there are many men that will support it if they have their awareness brought to their attention so that they understand it. It's sometimes simply a matter of just, I never thought about that.
Yeah. Yeah. I tell my husband all the time, I've been educating him every step of the way as I work from home. So he's my coworker, but I get to tell him everything so that he understands what I'm going through. So before we go, where can women go and get help for this? Because most of them, like I said, they turn to their doctor and they're not getting that help. Doctors are typically not very educated in hormone replacement. They think that estrogen is going to kill everybody. And I know you're a big advocate of estrogen, as am I. So where would you suggest somebody going? Definitely to your site, definitely to my site, but where can women get the help to get rid of these symptoms so that they can flourish in the workplace during their menopausal years?
Well, I understand some doctors are quite knowledgeable, but as you say, many regrettably are not. And I do want to say that whether or not you take hormones is not the point. If you choose to take hormones, that's good because it will go to your whole body and you get most of your symptoms taken care of. But if you don't want to, or you can't, that's okay too.
Yeah.
Because there are many alternatives to hormones, and that you need to have more individualized, but you just need to find someone who can help you. To help you find someone, which was your question, In the United States, there's the North American Menopause Society, can tell you people who are certified practitioners. I am, but there are others as well, many others. And then there's also a Canadian Menopause Society. People can look there for support. And the most important thing is to identify a practitioner who you can work with, who can help to educate you, not only on hormones, which, as I said, are important, but not exclusively your only option.
Yeah.
You can get other kinds of exercise, treatments, and you need to optimize, your basic lifestyle. No matter if you take hormones or you don't, you've still got to work on getting enough sleep, getting enough exercise, eating the best meal, the most organic or at least whole foods that you can, and lowering your stress, because right now this is a stressful world we live in. Every day something new, and all of those things contribute to menopausal symptoms and quality of life. And if you take estrogen by the handfuls and you aren't eating well or resting well or exercising or lowering your stress, you're still going to be miserable.
Yes, exactly.
So you got to, as I say, you have to take care of the sum of you and not just some of you. And you've got to be able to get someone to work with, healthcare provider, someone who you can talk to about it. And if you find that the one that you're working with is terrific for everything, but they don't get the menopause thing, well, then find someone just to support you for menopause.
Yeah.
I do offer coaching through menopausecoaching.com, but there are lots of people who can help you. And the most important thing is to get help.
Yes.
Realize
Agreed.
It's out there, and don't accept that you're not going to do anything, because toughing it out is not the way to go. It's figuring it out is the way to go.
Yeah, I couldn't agree more. I always tell people, whether you see me or you pick somebody else, doesn't matter. Just get the help, because it is out there. You may need to really search for it, but there's so much education, so much help to be had. You just got to go out and find it. And sometimes it's a lot of doctors are actually very open to being educated about the matter as well.
Yes.
Like I do find there's some doctors that are open-minded and say, oh, you know what? I have no idea about bioidentical hormones, but I'm open, sure. You want to try this?
I often help people with putting together a plan, and then they go to their their healthcare provider is. And usually, because I'm not offering something that's weird or strange, I'm offering, evidence-based treatments. They often are happy to have it. They just don't know what to do or are unconfident. And I mentioned again, the name of the new book is called Working Through Menopause. And it is a very interesting read if you're someone who is in menopause, if you're someone who has a business and wants to see how it's affecting it, or if you are a business owner and you want to see what you can do in your business, because it'll walk you through it and explain the issue. And there's a lot to know. And I think that as we move forward societally, we're going to find that this is going to be a very important part, not only for improving your bottom line and your productivity, but also for legally protecting your company so that claims aren't made against the company because they aren't supporting something that's, is required to be supported.
Yes, it's a very eye-opening book. And I hope that, looking into the future, that it starts to become just as important as when women are pregnant at the workplace, that there's that equality there, where we address it as a very serious matter that needs to be addressed and needs to be taken into consideration as women age in the workplace. And there's nothing to be ashamed about it. And it needs to be welcomed, and education needs to be there in the workplace about it. And I think everybody will be better off for it. So thanks for writing the book. Thank your wife for us also for writing the book, because she was a big part of it. So thank you to you both. And I'm going to link to the Amazon link for where you could buy the book, and be sure to leave a review for the book as well on Amazon after you read it.
Thank you so much.
Yes. Well, thank you for coming on the show for a second time. It was great to have you.
Been a pleasure. Thank you.